Okay, so I'd like to call the meeting to order. We have a relatively light agenda. Um, we're going to start with discussing the board committees. We may not be able to vote on the change yet. And if we do end up with a quorum at any point during the meeting, we'll circle back to the vote. But during our January meeting, we discussed the current committees and some suggestions on how we could modify the functions of one of the committees. So you'll remember initially last year, what we talked about was the need to sunset the communications committee. And we wanted to look at what our action plan will have in place for us moving forward, our strategic plan for the next few years, to see what committee structure makes sense in supporting the work of the Department of Health. Can everyone go on mute? I hear some background noise. Thanks. So through that discussion, we looked at the functions of each of the committees, and I'm going to ask Tim and Lisa to kind of give a really quick overview of the committees that they currently chair, so that folks know the functions of those committees, and then I'll talk about where we landed on which committees we'll have going forward. So Tim, if you could just talk a little bit about the academic partnership committee. I know that it hasn't met, but like the purpose of the committee.
Yeah, thanks, Serena. This committee is, I understand it, and Craig or others can jump in and comment on it as well, is to talk about, as it pretty much as described, the partnerships with the academic partners in the community, which could include SLU and UMSL and WashU, and how they can further the public health mission for the city and the region, and that's pretty much, you know, anything that falls under that purview is what that committee talks about. Does that make sense?
All right, Craig, did you want to add anything? And I put the name of the committee in the chat so that folks know the title.
Right, I think obviously Dr. Tim covered it. We are very blessed in St. Louis with tremendous academic institutions, and we have great relationships. They are very supportive with regard to our data and providing some of the great research and other efforts that we're doing for workforce development. We've done some things with regard to policy and legislation as well. So yes, the academic health department, which has been supported by the Missouri Foundation for Health for the last 3 years, has been a part of that.
Okay, so you can kind of infer from the title that most of the folks on this committee may be affiliated with one of those academic institutions, but that's not a requirement for being on the committee. So all board members serve on a committee. There are we're proposing 3 committees. So as you're listening to the descriptions, kind of think about which committee seems like something that you would be interested in contributing to. And then we'll talk about the process for assigning to committee so that everybody has a committee assignment by the time you're officially termed on next month. So that's the overview of the Academic Public Health Collaborations Committee. Is currently co-chaired by Dr. McBride and Craig. I will say that they haven't been as active, so the board hasn't been participating, but the work of the committee has really been carried by staff. So we want to make sure that going forward, we have active board participation as well. So think about your availability, the times that you could contribute, that kind of thing, as we're thinking about committee assignments. And if any questions come up, just throw those in the chat and we'll monitor that to be able to respond about that specific committee. All right, and I think, Alma, are you in the meeting? We see, it looks like.
Yes.
Okay.
Good morning. Yes, I am. Sorry, I didn't have the link, so I just joined about 5 minutes ago.
Thanks, Alma. All right. So then our second committee that we're continuing is the Governance and Nominating Committee, which is, very self-explanatory, and most of us have interacted with the chair of that committee, Linda, already. But Linda, can you offer a brief kind of overview of what that committee works on?
Of course, I'm happy to, Serena, and I just also wanted to say welcome to all of our new board members who are on today, many of whom I had the pleasure of speaking to on the phone. So we're really delighted to have you all here. So the Governance and Nominations Committee, I guess serves a couple of functions. One is to make sure that our bylaws as a city board currently reflect the practices that we would like to employ to serve our best function, which is to provide advice and guidance to Dr. Maddie at the City Department of Health. So a big project we took on, I guess about 2.5 years ago, was just kind of revising and updating our bylaws and looking at other cities and other communities to see sort of how they functioned, how they organized, to make sure that we were using best practices here on our board. And of course, the other half of our work is recruiting new board members. And this year we will have at least a small handful of people terming off this year. So there will be recruiting that we need to do. But it's actually, I will say as a personal aside, it's been a pleasure to recruit people for this board, because unlike a lot of nonprofit boards, when you ask people to join, you're not asking them for a financial commitment. So it's just nice to get people to offer their advice and expertise and let them really participate in civic life. Thanks, Serena.
Oh, we're not getting paid for this? That's it. Sorry.
Checks in the mail, Dr. Bradley.
All right, thanks, Linda. And
Sure.
again, if folks have questions, you can drop those in the chat. And now that Alma is here, we do have quorum. So once we go through all 3 committees, we'll be able to vote on the proposed 3 committees for this year. So this third committee, we have currently a health communication committee, and Lisa has chaired that committee, and they had some phenomenal projects that they worked on over the years. And we looked at the fact that with the new leadership at the Department of Health, Dr. Maddie specifically, that the bench strength for communications has really improved. There are so many things that the Department of Health initially relied on the committee to assist with that they really no longer need the same level of assistance with. So the committee found itself kind of looking for things to do, which is not a bad thing when you have capacity internally to get the work done. So we still have the same desire to contribute. And what we talked about at our meeting in January is that the intent of the communications committee was really always to be able to share information with community so that folks were aware of what the Department of Health does and that they knew how to connect to and access services as needed. And that's still a need. But one of the ways that we could consider doing that is really focusing in on strengthening our community engagement overall. So developing a strategy to be more specific in how we reach populations of focus, to really support some of the newer initiatives like the Bureau of Health, and to start to think about communications, not so much as in the creation of marketing material or content, but in strengthening our ability to network and give information to community, and then bring in community voice into the work of the Department of Health. So the adjustment that we're considering is, instead of calling it the Health Communication Committee, calling it the Community Engagement Committee, so that it's more clear that the purpose is really on strengthening the bi-directional communication between the Department of Health and the community. So that's the shift. So it doesn't eliminate a committee, it kind of repurposes that committee. And Lisa, did you want to add anything on that?
The only thing was that the rationale behind this is that we have a very demographically diverse population in the city. And with the old communications committee and with the community engagement committee, we talked about the need to be able to feel confident that all of our citizens, even our new, even our refugees who speak different languages, know, hear, understand, and can act on to their better health. Accessing the services that the Department of Health and the city and their partners, their health delivery provider partners represent. So we need more outreach, more tentacles, more connections to the ethnic, age, race, cultural, language groups in the entire city, to make sure that everybody knows we exist. And we have a much higher profile now since Dr. Mahdi became our leader, but we still have a need for everybody on the board to think about the connections they have in the city to different groups that I just mentioned, and to make suggestions and maybe even help a little bit, reach out on, depending on what the health issue is of the day, reach out to make sure that the leaders of those groups can give us counsel or can actually act on our behalf to make sure people understand what we provide. So it's more, I would say, more action oriented than just being a marketing communications counselor, and really leveraging our great diversity in the city and our diversity on this board. So that's all I'm going to say, but Serena, you represented it well. So peace.
Thanks, Lisa. And Lisa's one of our board members who's terming off. So I appreciate you being here for the last meeting to make sure that we have a smooth transition and we understand the work ahead of us. So those are the 3 committees. And what I will ask folks to do again is consider which committee resonated with you, or if you still have questions about the committees, that's fine as well. Feel free to email me. I'm going to put my email address in the chat so that everyone has it. If you have a preferred committee, if you don't, you can just say, hey, assign me to anything. I don't, I'm open, but just let me know what you're thinking as it relates to that. And that goes for current members as well. If you're serving on a committee right now and you want to consider switching to a different committee, if you are interested in chairing a committee, like, make all of those intentions known at this point so that we can have assignments ready by our March meeting. So the next thing is to actually vote on accepting these 3 committees. 2 of them we already have, but it's really a vote to accept the change from the Health Communication Committee to the Community Engagement Committee. So can I have a motion to make that change?
So moved.
Second,
I heard the second. That was Dr.
Colleen. Yep.
Thank you. All in favor? Oh, sorry. Process point. Is there any discussion or questions? Okay, hearing none, I will call the vote. All in favor?
Aye.
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 Thank you. Dr. Mahdi's voting as a former board member, I see.
Just my enthusiasm for this committee had to be noted this in some way.
Thank you. Opposed?
Serena,
Sorry, abstentions? Linda, go ahead.
I just wanted to mention that at our March board meeting, we'll pass an official amendment to the bylaws naming this committee. And so we have this change noted in our bylaws, because we do describe our committees in our bylaws. Thank you.
Yes. All right, thank you, Linda. So it passed and we now have a new committee. All right. You'll note that we do not have minutes from our January meeting. I will prepare those and get those out to folks. One reason we don't have minutes is because we have very light attendance, and we recognize that there is likely an issue with communication. We may be sending things to an email address that you don't check often, or an email address that's not active. So I'm asking everyone, if you're here now, at some point you receive some communication. But if you can confirm that we're using your preferred email address, if you have an assistant that manages your calendar and you would like for them to also receive email, please let us know that as well. But we want to make sure that we're not missing you when we think we're communicating to the entire group. And to that same degree, we would like to ask that going forward, you notify us if you don't intend to make the meeting, whether it's a planned event or something just comes up. But for the purposes of planning, it helps us to know who to expect so that we know if we're going to have quorum, if we can vote on something. And just as a courtesy, as the meeting approaches, make sure you confirm your attendance or that you won't be present for planning purposes. And if you're thinking, who should I email? Feel free to email me or Kimberly. You don't have to email the STL TV Zoom link thing, but email one of us so that we'll know that you're not going to be able to attend. And just to reiterate, that Zoom link reminder is kind of automated, so it doesn't come until the day before the meeting. But we try to maintain a regular schedule. So as long as you have this set up as a recurring calendar event, no matter when the Zoom link comes, you kind of know when the meeting is and how to access it. All right, I will stop talking and turn it over to Dr. Mahdi for departmental updates.
Why, hello, everyone. It's wonderful to see a packed house. It's even more wonderful to see my incredible, esteemed, and talented executive team who I will be bragging on throughout this presentation, which they do not like, so I want them to prepare themselves appropriately. I will start to share slides and talk departmental updates. I want to start off by just acknowledging Shantae Fluton, who's with us on this call. She is the person who prepares these monthly reports that you all say amazing things about. So I would really love if you could show her some love in the chat. It's easy for me to share my vision. I always just call people into my office, be excited about things, describe what I want, but they are the ones, it's Shantae who really realized this, put this beautiful document together. I want to acknowledge Kim, who does all of the editing and formatting and makes it pretty. And then I want to lastly acknowledge every single one of my executive leadership team who are overworked and meet every monthly deadline so that you have this report and these metrics. So Shantae, you are a visionary and we are eternally grateful for this opportunity to increase health literacy, communicate and educate our city and our region. So this month, I'd like to start off by our high impact items. For new board members, this is the part of the report where I try to discuss 2 to 4 high impact items that are currently top of mind. And this report reflects January. So this first month, we try to get it out at least 2 weeks afterwards, which gives us enough time to accumulate data and then share it with everybody. So the community continues to grapple with respiratory viruses during this winter virus season. The excellent news is that both influenza and RSV have significantly decreased. So after experiencing unprecedented number of influenza cases very, very early in the season, case counts have been trending downward in January and are lower than the 5-year median for the first time frame. As far as COVID goes, in January, the new Omicron subvariant XBB.1.5 continued to increase its presence across the country. So we're still seeing increases in case counts, in hospitalizations, but not on, but inpatient staffing beds, thankfully, are not on the rise. And so that variant accounts for more than half of all new cases in our region. Exciting new news that you will hear about later today, but also we'll ask members of our communicable disease team who are responsible for this, is the launch of our new HealthStop STL. HealthStopSTL.com's mission is to provide a one-stop shop resource to schedule no-cost confidential HIV and STI testing at the HealthStop Testing and Referral Center. You can also request free at-home testing kits, find no-cost condoms, and learn how to receive PrEP, a medication to reduce the risk of HIV transmission. This is a phenomenal website. Your homework, because I'm going to be way more aggressive about homework this year for board members, is to visit the helpstopstl.com website, share it widely, please. The department launched this service on the February 7th, the same day that we recognize National Black HIV/AIDS Awareness Day throughout our social media networks. So just congratulations to the team. What a wonderful resource when STIs continue to be on the rise, where we have unprecedented cases of syphilis and congenital syphilis. I see Dr. Tepe, who I welcome along with our other new board members, nodding in agreement, as this is the work that she sees day in and day out as well. So really excited about the Health Stop. Please visit it and send us feedback, but congratulations to the team. I'm also starting a new section in your monthly report, which is available funding through the health department. This year, we really want to increase our presence in being able to make funding available to the community. And so this will be another part of your homework. You know that I ask you every single month to share the job vacancies that are in the section. We make it copy and pasteable for you. And now you'll be able to do the same with available funding to folks in your network that you think can benefit. So I really hope that this will be a good addition for everybody. And as we now share with over 100 trusted partners, hopefully a way to get to increase engagement. So on the last slide, you'll find detailed information and links for two types of notices. One is the notice of funding availability, and one is a request for proposal. These are just very nuanced ways of getting monies out, NOFAs versus RFPs. So I won't spend a lot of time on COVID. I just talked to you a little bit about where we are. Spend more time with the report that comes out to everybody. So we have board meetings on Thursday. You get the report on Friday afternoons. So please spend a lot of time. We have both this more colorful, accessible PowerPoint version, but we also have a Word document, a PDF that has links at the top that you can click to go to different sections if you don't want to read it in its entirety. And so the team has worked really hard to make these reports accessible. I also won't spend a lot of time on influenza because I talked about the trends there, but even though there's significant decrease, let us take pause to really reflect on the 3,425 cases that we experienced through this season and the morbidity and mortality that reflects. It has been a truly historic influenza season, and I'm pleased to say that there's downward trends there as well. Violence prevention efforts continue in the 3 cure violence catchment areas. The graph shows the combined total of gun-related assaults, robberies, and homicides in the 3 catchment areas since January 2021. January 2023 saw the same number of incidents as January 2021, which is an N of 26. The Cure Violence team interrupted 11 potentially violent interactions last month, which is phenomenal, a decrease compared to the prior month, but December had an unusually high number of interruptions. We're in the process of securing a new agreement with the state of Missouri, and we'll provide EpiData in the next report as it pertains to behavioral health. But the Behavioral Health Bureau facilitated 7 task force sector meetings in order to gather community feedback for the strategic plan. Participants developed a goal for their sector. For example, substance use treatment, harm reduction, grassroots organizations, etc., which will be included in the strategic plan. The draft of that strategic plan goals by sector was sent out after the workshops concluded. The email containing the draft had an open rate of 42.3%, and several participants sent feedback to further improve those goals. The goals for each sector can be found in the diagram that you're seeing before you on the slide. The Bureau is working with the Missouri Institute for Mental Health to secure a supply of naloxone to be distributed by the Behavioral Health Bureau staff and to provide training on the use of a naloxone. And currently we're compiling data on citywide naloxone availability use and equity issues regarding naloxone that will be shared widely next month. So a lot of great activities. I'm also pleased to say that we finally got some folks to interview for the Bureau for our permanent positions, which is fantastic because we'll be onboarding them and they'll be working alongside our fantastic CDC staff, Dr. Timms, who's here with us today, and who you'll hear more from during our orientation. A truly visionary leader he's been for the staff so far. Mammoth amount of work, and we get a lot of great feedback about what's happened so far in that sector. During the month of January, the Health Promotion, Education, and Marketing team coordinated with DOH leadership and staff on various events. We co-produced weekly radio interviews with Streets 105.1. You can catch me every Tuesday at 9 a.m. I love that spot. It's such a great, innovative and accessible way to reach the public. I get so many interesting questions from the public, and we've really developed a wonderful relationship with them. The Department of Health expressed well wishes to Jasmine Frangel, who is our CDC employee deployed to assist with communications. She's no longer working with us, but her impact will be lasting. I think you've all seen her creativity and action over the last year. And just want to shout out Kim Vandenberg, the standalone member of Health Promotion, Education, and Marketing. So when you see all the phenomenal things that are happening, that is Kim and Kim alone. Kim is single-handedly doing a phenomenal job. I just have never been more proud to see her growth, her leadership, her impact in the city and the region, but show her love and be patient when you're asking things from her. We are currently interviewing for Harold and replacement in a new position. And I've added positions to the TO that I hope will be supported in next year's budget. But much love to Kim right now as she single-handedly holds the team up. I won't spend a lot of time on the remaining pages, but just want to say that communicable disease, one of our largest bureaus, continues to be very busy. We have three of the fearless leaders here with us today. They were awarded a grant to support perinatal hepatitis B efforts. Congratulations. They developed a call to action sheet for providers to improve identification of pregnant women with HBV. And they created perinatal hepatitis B prevention cards for L&D, OB-GYN, and pediatrics. The team welcomed 2 new investigators in January, so they continue to grow. And I'm proud of them utilizing the intern program that Slate has for paid internships, which has also helped us to bring people on and grow them and develop them. Oh, look at this beautiful Help Stop STL website in front of you. Just wanted to share with you a few details about this incredible new resource that I talked about earlier. And just a reminder that this will allow you again to book online Help Stop appointments right here at 1520 Market Street to learn more about HIV and STIs, about PrEP. We've got local resources, all the condoms you could ask for, at-home HIV and STI kits, testing sites for folks, and getting answers about testing, prevention, and other questions. I have the best team in the land. I do. Look at this. And when I say I barely touched this, I haven't even, they presented this to me. This is an incredible autonomous team. And I just want to show so much love to Natalie, who is on the call, to Tyrell and the rest of her team, who have the innovation is incredible. Congratulations, Natalie, and phenomenal work. We'd like to welcome Cheryl Collins to the Healthy Homes and Health Education team. Bobby has been out here doing work, growing his small but mighty team. In the last month, 14 participants attended the first 2 men's health presentations of 2023. Men's Health referred 50% of the men who participated to preventative health presentations to IHN for placements with PHPs. We love community collaborations and work. We successfully hired Cheryl Collins as a public health program representative for our Healthy Homes program and other health education services. And our Food RX team used January for further preparations for our 2023 season that begins in April. We provided education to 18 child care providers, in addition to sending 458 notifications or education material out to citizens regarding lead safety. 10 referrals were sent over to the building division for inspection and remediation. This is important, folks. This is, baseline foundational public health and work. And I give you these numbers so that you understand. A lot of times I have only 1 or 2 people working on any project at a given time. So these numbers that they're pushing out and the impact it has on people's lives and family and the health of young children cannot be underscored. Maternal health performed follow-up on 5 child fatality cases, and school health successfully completed, wait for it, 1,182 non-compliance letters to parents encouraging them to get their children, school-age children, fully immunized. Check that, the impact is on your screen. 76% of students are fully immunized in the city of St. Louis in private and parochial schools for which we are responsible. Come on now. As far as environmental health, one of our other largest sections, welcoming Justin and Scott, who are here representing today. January food inspection numbers have recorded higher completed routine inspection numbers despite the reduced number of staff. As a group, 118% more routine and 86% more total inspections than last January. We are focused on growth. So when you see the red areas in the link, I'm now pushing executive leadership to please consider what are they doing about this and to put that in the report so that you can see why maybe we're having decreases and what's being done about it. For community sanitation, they're on the front lines, often identifying opportunities to provide additional supports to the citizens in the city. The team worked hard in January to improve the habitability. I can't say that word, so I'm not going to say it again, but you know what I was trying to say, of homes and quality of life for those they serve. Environmental health officer, I can't say her last name, Justin, unmute and please unbutcher that name for me.
We'll just stick with Miss Maria for simplicity's sake. That's Maria.
Thank you, Miss Maria. Demonstrated the level of community outreach performed by the team. She distributed 14 weatherization kits and had additional resources, food, pantry, and utility, etc., dropped off at 2 residents. She posted 57 found pets housed at the city shelter to their next door neighborhood, and posted 2 reduced cost pet vaccination events to next door, reaching all city neighborhoods. Thank you for your service, Maria, and thank you for the impact on the community. In January, community sanitation team came to the aid of a citizen in need by conducting a summary nuisance abatement order. This was the first property that had been declared a nuisance due to refuse accumulation in several years, and the property owner had been cited and referred to court multiple times. The team identified that the customer needed more support than just, coming at them. And so environmental health led teams from streets, refuse, and forestry as we carried out the abatement. The resident, initially reluctant, was very pleased with the outcome and actually thanked our environmental health staff for the cleanup. Special kudos to inspectors A. Elliott and K. Wygand, who worked diligently to ensure the abatement was a process. And I loved getting feedback from my leadership about the concern they had for behavioral health support. So instead of just being out here citing folks, I have a team that is so concerned about those structural determinants of health and health equity that I speak to you guys about. So just wanted to share more tangible stories. Pet registration tag distribution has resumed after persevering through supply chain challenges for aluminum star-shaped tags. Bulk orders for veterinarian clinics and walk-in individual registrations are now being processed. And Justin is working very hard on some new RFPs that will go out to strengthen support for animal care and control in the city. We welcomed a new supervisor to the team. I'm just very proud of the diligent work. And if you're looking for more granular details on all of the work we've been doing in animal care and control, please refer to last month's report where we gave you a lot of detail there. Our FAB reaccreditation efforts continue. Team members continue to submit updated narrative for review and subsequent submission. The QI team is currently reviewing to ensure that the narrative meets accreditation standards. CHIP is also moving along well, working with action teams to confirm goals and objectives for each of the priorities that were identified in the recent community health assessment to prepare our final CHIP document. And for quality management, as of this Friday, the department will have successfully completed a QI Train the Trainer series to enhance leadership and key positions' ability to facilitate and lead QI projects. Through this effort, all 6 QI projects that are included in our QI plan have made great progress. They include onboarding process for new employees, succession plan for management positions, updated job descriptions, improved internal communications, tracking system for data sharing, and improved fiscal processes. When I say my team is busy, I say busy. And training sessions are like 3 hours at a time, every week and sometimes twice a week. And they have been committed and showing up. So thank you to the executive leadership team and all those involved. Rhonda's leadership has been absolutely phenomenal. We have several jobs currently posted on the city website. Please feel free. We need you to share these widely, especially since we have all of our behavioral health new bureau positions here. And we really want to fill that and get this team up and going and to have a smooth transition from our CDC team. This is the new section I talked to you about that will educate you about opportunities for funding in the city. And so there are currently 2 notices of awards availability and 3 RFPs. For your convenience, we'll include links to the available information. So we're making this as easy as possible for you to share in the community. And I'm excited for the new community engagement team to really utilize this section and the available job section in their community engagement efforts as well. Lots of events that we're involved in. Take a look, come and support, share widely. We're still vaccinating people. Remember May 11th, the public health emergency for COVID lifts. That's going to have really significant impact on folks who do not have health coverage, as not everything will be free as we've enjoyed to date. So we're really trying to get vaccinations and boosters up, and you will see a lot of vaccine clinics right there showing our commitment to working with trusted messengers, with our faith communities, in our rec centers, and in other key areas. So with that, I will shut up and open it up for questions. I felt like a rapper trying to get through that in a timely fashion. Questions, comments, concerns?
So I will start. I do have a question about the last comment you made around the public health order lifting in May. And I don't know that folks understand the shift that will mean towards being able to get free tests, free vaccines, and those types of things. What can we do to amplify that so that people are clear that there's a countdown happening and they should be paying attention to this?
Thank you for that. We're committed to sending communications out to the community. So the next monthly reports and the ones after will have reminders. I will also send a really great document the DHSS has put together to list every single change that's happening and how it'll impact folks with the report tomorrow on Friday. Yeah, tomorrow. So thank you for that, Serena. Your leadership's always so awesome because you helped me to think of things I hadn't thought about. So we'll include that one pager, maybe just a little bit more than one page, so that you can use that in educating the public. Kim and I will work on a campaign, both video and through social media and email communications. And as it gets closer, you know, I owe people a town hall, would like to do a hybrid just as soon as Kim has help. And that'll be a great time to help people understand as well. It would also be a good time for me to reach out to our partners at the Regional Health Commission who are instrumental in Medicaid expansion efforts over the last decade. And we want to thank them for their partnership as that initiative has now come to a close. And we can work with them, IHN and others, to increase reach about that. IHN has facilitated a successful RFP award to all of our FQHCs around COVID. And so we'll make sure that information is with them too, as they're educating for the May 11th date. So there's a couple of things that we can do to roll that out, but happy to take any other question, any other suggestions.
I'll just add that there was an infographic that your team made around when you should go to the hospital if you are having flu-like symptoms. And we shared that with all of our early childhood providers, our after-school providers, really anybody that works with children and families. And the feedback that we got, it was very helpful, that they were able to give that directly to families. It was easy for them to distribute. So as you're thinking about the types of communication tools, those infographics went over well with families. I definitely like the idea of having a document for providers so that we understand what the changes will be as well. But to the extent that you're also thinking about like members of the public and what they can see and share, that's helpful too.
Love that feedback. Thank you so much.
Dr. McBride, you have a question?
Yeah, thanks. I probably mostly wanted to raise my hand to just give a shout out to you, Dr. Mahdi, and your team for all the hard work that you do and the great presentation. It's really, it's the thing that makes me come to this meeting among many other things, because we learn a lot from you. So just a couple of things to add on, and you said the magic words, Medicaid expansion.
That's right.
You know, I was going to get excited when you said that. So just to add to the great comments from Serena, you know, with expansion, as you may know, this my pet project. We have about 307,000 people now in Missouri on expansion, including a lot of people who never had Medicaid coverage. And through Dr. Shanjo at WashU in homegrown St. Louis, we've been reaching out to a lot of folks in the St. Louis community and St. Louis region, and trying to, you know, it might be a really good idea to remind folks that, you know, that could be a really good use of your Medicaid coverage that you've never had before to do some prevention. And so I think to cover those vaccines that, you know, why not do that? And so, and I'm a little bit worried about vaccine hesitancy. We've talked about that a lot during the pandemic. And although, a lot of us kind of want to move past this and feel like it's gone, I still think there's probably a good number of people who never got certainly their second, third, or fourth booster, and maybe even not their first. And I'm a little still worried about that. Do you have any information on that?
Yeah, I mean, it's a really tough time. Pandemic fatigue is at an all-time high. People really want to move on with their lives. And so I do think that Kim and I need to be thoughtful about the shift in messaging and saying to people, we want that for you too, but this needs to continue to be a part of your life, and prevention is better than cure. And I also am concerned from an equity perspective that this shift does not show the commitment to equity that we called for the federal government throughout the pandemic, because it will be Black and Brown communities, the elderly and the immunocompromised that suffer, right, if there isn't a plan to support them. And so this is of great concern to me. Thankfully, my conversations with national leaders have similar concerns, and the push to have Congress assign funding for this is still ongoing. And so I continue to advocate on a individual level as well, and to use my platform to do that. But I do agree with you that there is a unique opportunity here to really use the incredible work that has been done to onboard people with medical expansion to provide much needed education about what they can do in this regard. And so I will work on that and bring some thoughts back to the team, to this group. Before I take Dr. Bradley's question, I just want to embarrass him real quickly. This is one of our new members who reached out to me before even joining. He took last month's report that he received and sent me a notated version, every single page, with questions, suggestions, and concerns. And so I just want to highlight that, because I have yet to receive that type of feedback. And this is the kind of energy I would like from the board moving forward. It was just phenomenal, and it helped me to really think through things. It's easy to be complacent. And while I love how much you all encourage me and tell us what a great job we're doing, if we don't get that type of lens, it doesn't help us to be better and to push us forward. And so I got this incredible document, and I was so moved, and everybody knows what I'm like about protecting family time with my young children on the weekend, that I forced him on a Zoom on a Saturday to just workshop this with me. He was not happy with me, but it was a phenomenal conversation. So I just wanted to say what an incredible time to have such passionate new members. And I'm just very thankful to this group as a whole. Dr. McNichol reaching out independently to my team and offering support. This is just a phenomenal group, and I can give examples on and on, but I did want to embarrass him because I do want to keep that kind of energy going this year. Dr. Bradley, over to you.
Really? So the truth is, I baited her. Did I bait you? I baited her because I love talking with Dr. Monty, period, and about public health things. And so I actually kind of baited her into that conversation. I think I want to just talk about things that I hear, kind of like a stream of thought, not necessarily that you have to address them if any of them stick out to you. And I'm so appreciative of my colleagues in the Department of Health, and just really glad to hear the celebrations and the work. And I just want y'all to know that I'm in the trenches with you. I believe in you and your work and your effort in this service to our communities. So if any of these pop up for you all and seem like they might be useful, I want to be able to provide that as well. So with the influenza and RSV, great to hear that I think our transmission is down. I was just curious whether that correlates at all with an increase in flu vaccinations, or where we are with that. I just was kind of curious about what's happening there. Health Stop STL, incredible, and curious about dissemination strategies. Are we thinking about design and dissemination at the same time? What do we currently know about opportunities for dissemination? And you're probably going to hear a lot of me talking about like community power. So I'm ringing the bell because that's obviously what community I want to be a part of. But as we move forward, thinking about bringing communities into kind of review and engagement with that site, and giving us some feedback, and even our community-based partners to, intentionally involve them in ways that might mean that they would be helpful, they would be useful in disseminating. With regard to violence prevention, I didn't know if folks have heard, I think it might be the APHA has a policy that's out, and they're doing some advocacy around violence prevention and using community health workers in that space. And so I can provide the link to that, but I just wondered if that might be a possible place for synergy, because I know we have a growing and vibrant community health worker workforce, and obviously that is a strategy for equity. So in that policy, I think some of the things they're advocating for is like to make sure that money's allocated to train, to hire in local health departments, to encourage state departments to provide a budget for that. So that might be something kind of a newer innovation that St. Louis might benefit from. And I have a colleague who's working in that space, and I asked her if St. Louis was anywhere near that, and I don't think that we are yet. And then, I was going to say, there's room for a little grace in your charts, right, in your data, because like with the community sanitation, you said the complaints you respond to is up 19%, but then if you go down, it's like there are percentages that are down. So that's kind of not fair, right? Because you got more work. So I imagine, though, that as things go, like I think you're probably developing a trend. I think we talked about this, like you're developing a trend. So as you develop your trend, then you'll be able to say, well, this is the goal that's meaningful. And then you say, like, this is where we are above or below that. And then that gives us kind of an indicator of what kind of resources we need and how we need to advocate and how we need to think. And then my last thing is just to ask of you, Dr. Mati, like, what are the best ways for you to receive feedback? How do you want that feedback? What do you want to hear from us, and how will it help you? That's all.
That was phenomenal. So let me start from the top, bottom up. I'm going to ask Natalie just to talk a little bit about the Health Stop STL campaign outreach, what we've done so far. Kim is already in my inbox saying she was driving to work, because this is who Kim is, thinking a little bit more about that as well. I'm really sensitive to the fact that, of course, this is an email and internet platform. So what are we, as much as it's needed, how are we reaching the folks who don't have access, right? So I'll have Natalie talk about that in a little bit. I will look into and provide feedback on flu vaccination as they correlate to the numbers coming down. This is really a typical epi curve. So I can come back from my ID hat, which is kind of fun because I don't get to nerd out from ID. So I don't see anything that is outside of the normal of the way the curve usually goes. And it looks more impressive than it is because it was such a steep curve up in breaking a 10-year record that the curve down looks more impressive than it really is. But as I was following our monthly influenza reports, I do not believe, but I want to confirm that our vaccination efforts were any more robust than prior seasons. But I will come back with that. Would love to connect and bring our Office of Violence Prevention leadership back to this group, because we now feed into that new office, but we are not taking the lead. They've done a lot since we first introduced them here. Our chair, Serena Mohammed, works very closely with them. And so inviting Will Pinkney back to kind of discuss more. And I love that you're bringing in some of these new things that are happening at the APHA. And then as far as how I like to receive feedback, in any way that is easiest and simplest for you all. I think it's really exciting and helpful. There's a lot of people in the community that watch these live streams come back to them. So it's always great to have a robust debate here, but we're limited in time. Email, I will take a meeting. I will take y'all out for lunch. Anything that helps me to be better, I will jump in feet first, because the board has the front row seats to our department and to being able to give us feedback. And I've never seen a more engaged board than in the last 2 to 3 years. And I hope that trend will continue with our new members. So with that, I will ask Suzanne and then Natalie just to talk a little bit about what we've done as it pertains to Health Stop STL. Suzanne first, anything you'd like to say?
Yes, I have a lot that I would like to say. Mostly it is to acknowledge the incredible hard work that Natalie, who does not have a master's in information technology, managed to bring on board, because it is quite an endeavor to get a website not only launched, but hosted with the city. And she managed to make all of that happen. She also has a plan to add additional interactive pieces as we managed to collate the feedback that we've received from the community to date. We'd like to move forward with more maps and more visual aids. And we also will be training staff internally on updating content so that we maintain a fresh and current perspective. But again, the real author of this endeavor is Natalie, and I'd like to turn the floor over to her.
There you go. Thanks, everyone. So yeah, we are very excited about this new platform. In some point, the program have a way, a website to communicate the same information. However, with COVID, things had changed. Our program had changed, our community had changed. So that is something that we were looking to incorporate now into that website. What are the resources available, and facilitating that access to the community, to resources, testing, condoms, home testing. So definitely, to piggyback on what Susan mentioned, one of the biggest goals is to keep growing in that platform and making sure we're incorporating all single aspect that the community might need to support, the services that we are providing at this point. So we still getting feedback. We're still working on it. It's live, it's up, but definitely there's always room for, education and improvement. So anything that you guys can see that it can make it better, we're all ears. But definitely what we want to do is a centralized space that the community have the access and see where the resources are in St. Louis.
And, Natalie is very humble, but one of the things that I love seeing when they did their campaign, because it happened while I was in South Africa, I was just like a proud mom sitting back on the beach looking at the campaign. I just decided to be a little cheeky there, but Natalie's team, one of the innovations that I liked about their community outreach is they had intentional partners lined up to also help with the launch. So really want to shout out Williams and Associates and their team and other partners. I heard the folks over at I Heard who support us so much. So there were intentional partnerships that also launched this out to have those trusted long-term relationships within the community. So please reach out to Natalie. Natalie, if you could put your email in the chat. And if you have specific feedback about how we can get this resource out more and continue this campaign, please reach out to her directly. I will turn this back to you, Serena, because I know we need to do orientation.
Yes, that's what I was just about to say. So we're going to transition. For our current members who are transitioning off, you're welcome to leave if you would like. We're going to do our orientation for new board members. If you decide to stay, you may learn something as you are exiting. So it's completely up to you. But I'm going to turn it back over to Dr. Mahdi to go through the orientation.
Thank you. I'll ask him to load the slides while I'm doing an introduction. We typically have an hour to do this, and we now have 30 minutes. So I'm just going to tell my team that you each have a minute, 1 minute tops. I'll be cutting people off for your respective bureaus because we need to leave time for questions. I'm also going to say to the new members, please relax. We will send these slides out to you. So if it feels like it's going fast, you will have enough time. And if Serena thinks it's necessary, we can always come back and do a part 2 at a future meeting. So welcome to this portion of the meeting where we'll do a very brief board member orientation. So thank you for joining us. Thank you for your dedication to the city of St. Louis. Today, we're going to go through our mission, vision, and core values that I will say are currently being updated through our new accreditation process. So you'll be seeing those updates soon. And then we'll talk to you about what that work is as well. Our mission currently is we assure a healthy St. Louis through quality public health services and partnerships by providing continuous protection, prevention, and promotion for the public's health. Our vision is St. Louis, an equitable community, achieving optimal health for all. And we operate through all the values that you see at the bottom of the page there. Just a little bit about our 6 priority areas to date for FY19 through 23, and that has been to strengthen leadership and workforce, support community health planning, implementation, and evaluation through our CHIP, foster data-driven planning, implementation, and evaluation with continuous quality improvement, strengthen information systems, advance racial and health equity, and identify resources to support personal and population-based health services. Again, you will be seeing our new priority areas this year. Those will be sent out to you. A lot of advancement has been made on all of these priority areas from the time that before I had joined the health department in October of 2021 and ongoing. So I will hand it over to Rhonda to speak very briefly about our accreditation and improvement plans. You're muted, Rhonda.
Hi there. The department is accredited by the FAB Accreditation Board, and we are accredited normally every 5 years. The purpose of this is to advance and transform public health practice through performance improvement, innovation, and by building a strong infrastructure and culture of quality. We have requested an extension on our application to better align with our counterparts in St. Louis County and work regionally on some strategic initiatives. So our reaccreditation will be due at the end of December. Next slide, please. For accreditation purposes and also for improvement purposes, we have 5 plans that we maintain. One is the Quality Improvement Plan, which outlines our roles and responsibility for our staff and the initiatives we are taking to build a culture of quality, and also has a toolkit that helps staff process quality improvement projects. We have a strategic plan, as Dr. Amati mentioned. It's currently being worked on and updated, and we hope to tell you more about our strategic plan in the next Board of Health meeting. The Workforce Development Plan, this plan is made through assessments of our staff on satisfaction, employee needs, training needs, things like that. And it's basically a training plan for our staff. The Performance Management System and Plan, this is where we have a database where we have goals, objectives, performance measures for every program area. And we collect the data on a monthly basis, and we look at that data and compare it to our annual targets. And we see if we're meeting targets or not, if we need to implement quality improvement or not. And then lastly is our Community Health Improvement Plan. And this plan, which we call our CHIP, is a 3 to 5 year plan. It informs and guides our partners on how we can meet our community needs. This plan is currently in development. We have identified 5 priority areas: economic mobility and health, chronic diseases, maternal and child health, violence, and behavioral health. And these priorities were actually identified with our community input and in collaboration with all our partners. And this plan is implemented and led by our partners. In each priority area has an action team, and they are currently in the process of developing their goals, objectives, and activities. And that's pretty much where we're at with that.
Thank you so much, Rhonda. Dr. Timms, who is our program director through our CDC partnership, will now walk us through the behavioral health efforts.
Great. Thank you, Dr. Amati. So behavioral health is new, and I think our primary focus right now is we are working on substance abuse, opioid overdose prevention, and strategic planning. But the new Behavioral Health Bureau is not just about substance abuse and mental health. We're also looking at how we effectively prevent and help people live healthier and happier lives through a variety of ways. As we hire for the new bureau, we're going to have 2 arms of work there. One focused on linkage to treatment, care, and recovery. So really, how do we support those who are engaged in the care system in some way, whatever that might be? And then our other side will really be focused on those prevention efforts. How are we creating a healthy community that supports people in whatever stage of life that they might be in. So we have 14 vacancies. We are actively interviewing, so please feel free to send folks our way. For Overdose Data to Action, which is our initial projects, we're doing a comprehensive map of services, which is the snapshot that is available on the behavioral health website, the DOH. Take a look. There's some really great maps there that'll give you an idea about where services are happening or not happening. We are about 90% done with a strategic plan. We are still gathering feedback and would be happy to talk to any of you about that. We also are working on a data project where we'll be able to make our overdose and behavioral health data more easily accessible, hopefully through a dashboard. And then we also have a health equity roadmap, which will deliver a variety of projects really to help narrow in the work around behavioral health and health equity in the city, we hope. So lots of big projects. A lot of those are really far into the work. Again, our focus is on prevention, education, and awareness. We are also really engaged in how treatment is working and where it's located and how we might work to expand access to treatment or care that matches the community that's being served. And so these things. You can go to the next slide. Trying to be quick. Thank you. I'll stop there.
Thank you so much. I'll ask Suzanne Alexander to walk us through CD.
Love to. Communicable disease is all about what affects our community in a way that can be spread to other people. It encompasses our Ryan White program, as well as our HIV surveillance, HIV prevention, education, and risk reduction activities, medical records, perinatal hepatitis B, and our investigative department. Next slide, please. Our team works very closely together. Our surveillance supervisor assists our CD investigation team and HIV prevention team in providing services on an emergency basis to the community. One of those was our Mpox vaccination clinic, which was, and I'd like to take this moment to acknowledge my gratitude toward the amazing leaders that I have working for me, Veronica Roy, Natalie Torres Negron, and Valerie Newbern. Valerie Newbern, from the time that we received our first notice of a positive Mpox case on July 13th, managed to design the first large-scale vaccine clinic in the state of Missouri to attend to our community. And by October of 2022, had provided, with the assistance of the rest of the communicable disease and emergency preparedness departments, over 850 vaccines to our community, which I believe is one of the reasons we were able to keep our caseload under 100 confirmed cases. Actually, it's under 75, but who's counting? Valerie and Natalie worked closely together to provide HIV and STI testing at that Mpox clinic as well. And that's just an example of how the communicable disease works together closely to ensure that we're not just providing the services, but the education and awareness as well. To that end, we are continuing to work collaboratively to make awareness days such as the National Black HIV and AIDS Awareness Day event that we had in the lobby of 1520, where we served over 95 visitors, provided a dozen HIV self-tests, which can be taken home and conducted in privacy, and rapid testing at our Health Stop clinic. They supported each other through this endeavor, and that is just an example of the work we do in communicable disease. 1 minute, did I do it? Okay, yes. So these are our program outputs. I would like to point out that our program outputs may look a little bit reduced in number. That is because our bureau has been reduced in number, and which is another bragging point for my supervisors. They have both been operating with anywhere from 1/10 to 50% of their team for the entirety of 2022. And thanks to Dr. Mati's efforts working with the department and personnel, we were able to start to rebuild. To that end, while these numbers may look less than they did the year before, I would like to point out a couple of things in particular. Every person who has been tested for HIV has been offered referral services, support services, whether they are Ryan White eligible or not. We are committed to ensuring that no one falls through that gap in the safety net. I would also like to point out that Valerie Newbern finished 2022 with a record of 5 open cases. When I first arrived in the Communicable Disease Bureau, there were pages and pages of open cases, and Valerie Newbern has been very intentional about reducing that backload. So these are what we've been working on while continuing to hire, build, onboard new folks, and improve our services through quality management.
Thanks so much, Suzanne. Sylvia Jackson Bell is joining us to talk about grants administration.
Thank you, Dr. Monty. Grant administration is a section of CD that administers two federally funded programs that provides direct services to people living with HIV and AIDS. So, you know, we're like a part of, yet apart from CD, but we've been able to lean into public health through the hiring of two master's level public health professionals who both have served in communicable disease. One of the programs that we administer is the HRSA Ryan White HIV/AIDS program, Part A. You know, Ryan White has several cross parts. We administer the Part A program, and those funds are used to provide core medical and support services for persons living with HIV and AIDS as a payer of last resort. We focus in on core medical and support services, and for the St. Louis TGA, our services are basically outpatient ambulatory, oral health, early intervention services, emergency financial assistance, food bank, health education, risk reduction, housing services, legal services, medical transportation, mental health, medical case management, medical nutrition therapy, psychosocial support, and referral for healthcare and supportive services. The second program that we administer back in grant administration is a HOPPER program. And I must admit, I love this program, guys. This is a program that's funded through HUD, and it is the only federal program dedicated to the housing needs of people living with HIV and AIDS. The reason that I love this program, though, is because it is very client-centered. The client gets to determine who makes up family. You know, and it's one of those programs where once they identify who is family for them, that person can receive services through HOPWA. The program, again, is managed by HUD, and it was established to provide housing assistance and related supportive services for low-income persons living with HIV and AIDS. In our community, we have two providers, Doorways and Peter and Paul. Doorways basically provides short-term rent, tenant-based services, housing information services, whereas Peter and Paul facilitates an on-site facility-based program, as well as provide supportive services through case management and mental health services.
Wonderful job. Thank you so much. And over to you, Justin, for environmental health services.
Thank you, Dr. Mahdi. Good morning, everyone. Justin Hauser, Environmental Health Bureau. We have 6 sections in environmental health, primarily focused on regulatory and enforcement activities. There are food and beverage inspectors that ensure the food establishments are following the local and state food code. We have environmental health officers that complete inspections for anything that's not a food establishment. So lodging establishments, pools, and daycare facilities. We also have animal control officers that enforce ordinance on pet ownership within the city. And then the other 3 sections that round out environmental health are air pollution control, vector control, and emergency preparedness. Air pollution control primarily focuses on asbestos abatement during building demolitions. The vector control team responds to requests for issues with rats and mosquitoes. And the emergency preparedness program, they develop and maintain the emergency response plan for the Department of Health, and they also carry out the response operations for the department. This next slide just echoes the theme of the Department of Health. Will you go back one, Kim, please? This slide is the theme of the Department of Health. It's a very small number of people doing an incredible amount of work. These numbers are included in the board report, so I won't regurgitate all of them, but I will draw attention to the last one for emergency preparedness with the 89 vaccination clinics. That's over 3,700 COVID-19 immunizations, and that wouldn't be possible without the support of over 1,000 volunteer hours from the Medical Reserve Corps team. The last 2 slides just go over the emergency preparedness program, and they also highlight the partnership. So I'll talk briefly on the very last slide. This just goes over the different partnerships that we have with other agencies in the area. Heat Up St. Louis for utility assistance, for example, the Missouri Department of Health and Senior Services Respiratory Protection Program for fit testing. And then we also collaborate heavily with the STARS and East West Gateway groups. That's it for me. I'll hang out in the chat for any questions. I hope everybody has a great day. Thank you.
Come on, Justin, you can't do that in a minute, but look at him. He did. And just want to shout out Scott Geary, one of our newest supervisors, passionate, incredible and a great asset to the team. Amir Tibbs, who's not with us, and Patrick, who's not with us, rounding out some of the other supervisors. Over to you, Dr. Moshe, for our Epi Bureau.
Yeah, thank you, Dr. Mati. Good morning. Yeah, I would like to begin by mentioning that the Epidemiology Bureau has a team of 8 epidemiologists and 3 QI specialists. We support determining the burden of diseases, risk factors, and health-related events here in the city of St. Louis. The AP Bureau also supports all DOH programs when it comes to data analysis, data collection, data analysis, and reporting in different program areas, including communicable diseases, chronic diseases, injuries, environmental health, behavioral health, maternal child health, violence prevention, and health equity. In addition to that, we also do conduct routine syndromic and active surveillance. Also, the AP Bureau supports outbreak investigations of diseases such as COVID-19, monkeypox, and some of enteric diseases. The AP Bureau also support, all DOH programs. Thinking of QI monitoring and evaluation of program performance. We also do support, our external stakeholders when it comes to data or report needs. We also support development of some of the DOH policies, documents, and strategic plan. Last but not least, the Epidemiology Bureau do conduct and contribute in research. Here are some of the main areas that we do support when it comes to research. But I would like also to mention that we do enjoy a good research collaboration with our academic partner, particularly SLU and Washington University. Over.
Thank you so much. The work that they've done to bring an equitable data-driven approach to all of our work has been phenomenal. Over to you, Bobby, for our Family, Community, and School Health, which some of you may know as WACA previously.
Thank you, Dr. Mahdi. So at Family, Community, School Health, we have a very dedicated team. In our MCH program, we focus on trying to encourage child age-bearing mothers to take advantage of prenatal and postnatal care so that we can positively impact our morbidity and mortality rates that are related to pregnancy. Our Let's Screen program, we have done a lot of work to ensure that children from 6 months to 6 years of age are screened for lead safety purposes, ensure that their elevated blood lead levels are where they're supposed to be, they're not high. Just to give you a little touch on that, we have only one public health nurse that's working in that area with the help of a community health worker, but she has done a wonderful job of reaching out and making contacts with St. Louis Public Schools and other schools in our community, ensure that we are increasing our reach and able to provide those services to all the children of the city of St. Louis. Also with our school health program, we're going into, thanks, Gil. For our school health program, we're making sure the immunization and vaccination vaccinations are up to date for our school-age children in our schools of responsibility. We also provide a lot of training in the community for child care workers. Last year alone, we provided 48 CPR first aid classes. That's a lot of kudos to Angela Buchanan and also to Lakiska Stevenson and also Denaro Mack in helping to accomplish that. That's really important because without those certifications, without those trainings, childcare workers will lose their jobs. And of course, they love coming to us as well because it is free through the City of St. Louis Department of Health. Otherwise, they would have to pay for that. So that's a good service we provide to the community. Show Me Healthy Women. We want to welcome Ms. Margaret Laycock. She's one of our new public health nurses that we have in that position. So we're really happy to have her and excited about how we can continue to increase our reach when it comes to cervical and breast cancer awareness and also holistic women's health. And then also we have our health equity, our section where we do a variety of programs. We have our Food RX program that focuses on hypertension and diabetes. We also have our Healthy Homes program. Dr. Marty mentioned that already, which we are in a collaborative group with the county and other LPHAs and also energy efficiency corporations to make sure that homes are healthy for our families. And then also there's our men's health program. And I want to give a quick shout out to Dr. Bradley. Appreciate all of your help that you provided with that. Dr. Bradley, just to let you know that your work was not in vain. We did get over 100 men's health presentation surveys collected, and we're still analyzing that data, and we'll present that once we get those analysis completed. And also, Dr. Bradley, yes, we did increase our reach. We are now officially in the transition center, and we will update the Board of Health with that work as that work continues to progress as well.
Thank you so much, Bobby. And I will now ask Emmanuel to do fiscal.
Thank you, Dr. Marty, and good morning, everyone. The Fiscal Bureau is made up of 4 accountants, 1 contract compliance officer, a payroll specialist, a secretary, and an accounting manager. And most recently, we got approval to hire an auditor. So we are still in the process of filling the auditor position, plus myself. Also, we make up about 9 staff in that bureau. And some of the major things that we do in fiscal includes working with the program managers at the beginning of each fiscal year to put together the fiscal year budget. We work with the program managers within Department of Health and also the budget division for the city to put all the budget, both for the general fund, which is the tax funds, and also for the grants, and submit those to the budget division. In the fiscal section, we also coordinate the contract process. So once we have the RFP and we have the approvals from the different levels, we work with the program to put together the contracts, and then work with the city councilor's office, the controller's office, and the registrar's office, and all the other different sections of the city that are involved in the contract process, to make sure that we have fully executed contracts before we are able to issue payments for the services that are being rendered. We are also involved in a lot of financial reporting for our grants and different levels of reports to the state and to the federal government. Most of the reports are on quarterly basis. We also have some that are annual basis. So we have a lot of reporting that we do on our grants. And then we also have the payroll specialist that manages the payroll process for the Department of Health. That a lot of work, but it's something that is part of the fiscal process, and this payroll specialist does a very good job in managing the payroll, working with the controller's payroll department, and working also with the personnel division to put all of those together. The Fiscal Bureau is also responsible for managing the equipment and the assets for the Department of Health. All the different equipment that we have to keep stock and take stock and have an inventory and proper management of those equipment and assets. And we work with the Comptroller's office in that effort also. And then currently we have a professional accounting firm that is working with us. We've entered into a contractual agreement with them for them to work with reviewing our internal controls and processes and reviewing our different policies and procedures on fiscal processes. So they were supposed to work with us through the month of March, but it's being extended through the end of June. For this year, they are also going to handle the fiscal monitoring of all of the sub-recipients that we work with, which has been one of the areas of challenge because we don't have staff that are able to do that. And thankfully, we have the auditor that is approved for us to hire. So once we have the auditor in our department, that is going to be the person that we lead the process of fiscal monitoring and also support the programs for programmatic monitoring of all the sub-recipients that works with us. So that's a brief overview of the Fiscal Bureau.
Thank you so much, Emmanuel. A lot of great growth that has happened in fiscal. So we have exactly 1 minute each for government services and health promotion. So first, Craig for government services.
Good morning, board, and thank you so much for furthering your work in public health on the board. And although Serena said you're not going to be bringing your own money to the table, of course, you bring so many other resources, and we thank you for that. As a government services, in the government services realm, we work to support the awesome team here at the City of St. Louis Department of Health to further our mission of equitable community, achieving optimal health for all, empowering people and organizations through collective action for the public health. We have a supportive role in the administration. We're not the folks who are doing the public health inspections, enforcement, testing, and so forth, but we act as a navigator for all things government, helping people and organizations to function and connect with their government. We're advocates for the consumer. Those consumers could be a community resident, a business, a fellow staff member, a visitor. We're not always accepting things as they are or understanding them as they are, but we question why they are, and we try to change it when we can for the improvement of the quality of life of our communities. We can be that bridge between seemingly disparate groups, that we can be that oil that makes things work with a little less friction, or we can be that glue that keeps things together among government, community organizations, and the public. We facilitate health in all policies because so many sectors, transportation, housing, education, poverty, access to healthy foods, economic opportunities, and violence reduction are inextricably linked when it comes to public health. So on the earlier slide, you noticed that's going to be reduced to 14 tables there shortly. You can see some of the things we do with regard to policies and legislation. On the next slide, that shows you some excitement that we had when we were working in Carl and Columbus Squares with regard to some violence prevention activities with cameras and lighting. Also pointing out that we work, of course, with external and internal partnerships and the academic health department. And that here lately, we've been assisting a lot with requests for proposals, grants, and contracts, and to making sure that contractors and subrecipients are paid for all their great work when the city contracts it out. That's it for government services.
Thank you so much, Craig. And a phenomenal amount of work happening to further equity and link our community with your expertise. Last but not least, Kim, and then we'll open it up for questions.
Thank you, Dr. Mahdi. So I'm with Health Promotions, the education and marketing team here at the Department of Health, and we work to support the amazing work of the team that you've heard today in this report, both in Dr. Mahdi's report earlier and in this brief orientation of our department. We also support communications between the department and the public, including media. So we work to facilitate media interviews for all outlets, newspaper, broadcast radio, broadcast television. We work with our partners, STL TV, which is also helping host this event, this meeting today, to record PSAs, public service announcements, and educational videos that then we put out to the community to help educate them on public health matters, as well as marketing. We talked about some marketing earlier with Health Stop, working on just ways to elevate the health department in the community and share the great services that we provide through this department. And so I will end it there to yield my time back to Dr. Mahdi.
Thank you so much. That was, I mean, I couldn't be more proud. We did this in an hour and you folks did it, and it didn't even seem forced. We have a couple of minutes for questions. We're going to keep this last slide up so that you can take a screenshot. I would like to request that every single new board member follow us on at least one social media platform and amplify often. We have the same handle, City of STLDOH, our phone number, address, and website address here for you to take a screenshot photo. Any questions?
Dr. McNicholas.
Yes, thank you. And every time I hear this presentation, I learn more things. So I love hearing it over and over again. I'm wondering, certainly the committees are one way that we as board members can be engaged and support the department. But as I was listening to this and thinking about the vast sort of expertise that sits on this board, I'm wondering how you, Dr. Mahdi, and the team would feel about some sort of structure that maybe has like a board liaison to each of your bureaus, or some of your bureaus, or the things that we have expertise in, as another way for us to be involved and support you. not for answer now, and certainly I understand how it is to work with the board. So for some noodling, but I'm just wondering, there's lots of great work happening, and thinking about that is another way for us to support you in the work.
I love the idea and the support. I think it's just about capacity in the past, and board members typically come from really challenging backgrounds. So I would like to have board members positioned to be as successful as possible and to be able to integrate as much as possible. If folks have that capacity, I think it's an amazing idea. I think we could do things like there has to be some sort of feedback each month from that area of the report. They are the liaison they meet at least once a month with the bureau chief to see ways to further initiatives. There's a lot we could do there. So I think for further discussion with Serena and maybe to put on the agenda for next meeting as well. But I think it's all about your capacity as well. So between committees and that, just something to think about.
Yeah, and I'll say when we were thinking about committee structure, we did think about how do we connect to all of the lines of work. And one of the ideas was that community engagement could be a place because it connects and supports each line of work. There's always some type of bi-directional activity that has to happen. So that was kind of the thinking behind that new focus for that committee. So I appreciate everyone taking the time to give us this orientation. It was very difficult to get the last one scheduled, so I just wanted to try to get it in when we already had our time together. And you did a phenomenal job. We do have a recording of the 1-hour presentation if folks want to hear it. But I will say, after listening to both, you got the core and the heart of the content, even in this half-hour presentation. So thank you, everyone, for your participation, and we look forward to seeing you next month. We are officially adjourned.